Hi guys, the disease that me and my group chose was type 2 diabetes. If you don't know what type 2 diabetes is, it's a chronic disease in which either your body does not produce enough insulin or your body cannot effectively use the insulin produced, thus resulting in sugar accumulations in the blood instead of passing into cells for energy production. This is the most common type of diabetes, as a rule linked with the lifestyle factors and weight. Although it can occur to everybody, even children, it needs management via diets and exercises and sometimes medication to avoid such a serious complication as heart, kidneys, and nerves damages. In this slide, I'm explaining how type 2 diabetes develops in the body. Type 2 diabetes mainly starts with the problem called insulin resistance. Normally, insulin helps our cells take in sugar from a bloodstream. But when someone has insulin resistance, the body's cells don't respond to the insulin the way they should. Because of this, the pancreas tries to make more insulin to keep blood sugar under control. Over time, the pancreas becomes overworked. The beta cells, which are the cells responsible for production insulin, starts to wear out and don't function as well as they used to. Eventually, they aren't able to produce enough insulin for the body needs. Several factors make these process worse, such as high level of fat in the blood, inflammation in the body, and genetics factors that increases the risk of developing diabetes. This is issue all reduce the cell's ability to do insulin effectively because the cells can't take sugar properly and the pancreas can't keep up with the insulin production. Sugar builds up in the blood. This is what leads to high blood glucose levels, which the main characteristics of type 2 diabetes. The diagram on the right shows how a normal beta cells work compared to how dysfunction happens during the insulin resistance in type 2 diabetes. In this slide explains how type 2 diabetes develops on three levels: cellular, molecular, and genetics. Type 2 diabetes is considered a multifactorial disease, which means it isn't caused by just one issue. Several differences defects in the body all contributes to it. Type 2 diabetes develops because of the defects in how cells respond to insulin, defects in how the pancreas produces insulin, and inherited genetic factors. All of these interacts with environments and lifestyle choices leading to the disease. For this slide, I'm explaining whether type 2 diabetes is hereditary. The short answer is yes. Type 2 diabetes does have a genetic component. However, it's not something that passes down in a simple way, like dominance or recessive traits. Instead, it considered a complex polygenic condition, which means that many different genes each add a small amount to a person's risk. The text on the slide explains the genetic to play a significant role. For example, the chart on the right shows a heritability score about 0.74, which means there is a strong genetics influence. Also, people with family history of type 2 diabetes are most likely to develop it. But genetics alone don't determine everything. Lifestyle and environmental factors are just as important. Things like diet, physical activity, and body weight can increase or decrease someone's risk. Even if they're genetically predisposed, the image in the bottom In the bottom right highlights factors such as low fat intake and physical activity, which helps lower the risk. Overall, the main point is that type 2 diabetes results from both genes and lifestyle choices working together. Having a family history increases risk, but healthy habits can make a big difference. And that's it from my part.